Hello friends, I know you have been eagerly waiting for Dr. Ashish Jain. Within seconds, Dr. Jain would be there to answer your question and queries. You can ask in both Hindi and English language. Now over to Dr. Jain.
Good evening, everyone. I'm Dr. Ashish Jain, Associate Director, Joint Replacement and Reconstruction, Max Hospital, Shalimar Bagh and Max Hospital, Pitampura. Well, the topic today, questions which we'll be asking is about the knee pains, knee replacement. Everyone in the house, someone or the other has a problem in their house with knee pains, either the grandmother, grandfather, parents, father, or even the youngsters. My prime focus is on knee replacement. One question which everyone asks nowadays is the incidence of knee replacement or the knee pains has increased tremendously. Someone or the other in the family has knee pain and or is undergoing a knee replacement. Previously, this never used to be so common. Tremendously. Someone or the other in the family has knee pain and or is undergoing a knee replacement. So the first thing we must realize when we talk about knee replacement is that average lifespan of our Indians have increased over past 15 years. Previously, the average age or average lifespan used to be 72 years. Nowadays, the average age is 87 or 88 years. Hence, the knee problem, which used to reach a stage where you need a surgical intervention to solve it, by the time that problem used to increase, the patients used to live no more. But now things have changed with advances in medical science, cardiac improvements, treatments. The average age lifespan has increased. Hence, this degenerative disease of knee or osteoarthritis of knee is what we call as. The incidence has increased and the treatment, knee replacement, has increased. Many people feel they do not require surgery and they can manage it with it. Well, yes, it is possible, but we must realize that knee problem or osteoarthritis, what we are talking about, is a degenerative joint disease which is bound to occur slowly to everyone. If briefly I try to explain why knee replacement is needed and what are the other modalities for knee pains, I'll try to explain it in next 2 minutes. Normally, this is a bone model here I have of a knee joint. There is a cartilage layer up and down. This is very smooth. As our age advances, there is a wear of this cartilage. Here, this wear keeps on increasing from that to stage 3. So these are the 3 various stages of osteoarthrosis of the knees. Normal, 0 to 35 years. As our age advances, the cartilage wears out and eventually there is complete loss after 55 years or so. This is the stage when patient would require a knee replacement. The problem is there is no definitive medicine or treatment which I start at this stage and I am reverted to normal or can stop from this stage coming. Whatever treatment or options are given are basically to decrease the patient's symptoms, pain without taking painkillers. In that, the medicines are very helpful but not painkillers. Healthy lifestyle is very important. Diet changes are very important. So what constitutes healthy lifestyle or lifestyle modifications? One is regular walk so that you don't be obese. 2, you walk regularly so that your muscle tone is good. How bad the knees are, that hardly makes difference on radiologically. If your muscle tone is good, you can continue. without requiring knee replacement. Third is regular exercise of the knees. Any exercise, be it cycling, be it walk. What I advise to patients is do what you can do at the age of 20 and do at what you can do at the age of 80. So that is simple walk. Regular walk, though 10 kilometers per day is a bit too much, but if you are walking that much, your muscle tone will be very good. Diet, very important. Garlic, broccoli, green tea, they play very important role in reducing the pain, in preventing degradation of the cartilage. Should avoid excessive salt, excessive sugar, excessive tea, fried foods. If those who are non-vegetarians, salmon fish is considered to be very good for cartilage. All these things are available in medicines also, but none of them are painkillers, but they are a bit expensive. So if we can get natural with diet and natural with exercise and lifestyle modifications, like you have to avoid squatting, sitting cross-legged, using Indian toilets, it's better. One doubt everyone has is newer injections. Any various injections are available and people have a lot of apprehensions. They feel it should not be used or should it be used. They are a bit confused. It's not bad, but they hardly work. They will only and only provide temporary relief. They are not a solution to the treatment. Injections can be simple steroid injection, can be viscose supplementation, or a PRP or a stem cell, what we call as. They are not a definitive treatment. अगर समझाऊं जैसे पेशेंट्स को, मैं तो यही कहता हूँ, ऑस्टियोआर्थराइसिस एक एज रिलेटेड चेंजेस है, बाल सफ़ेद होने ही होने हैं सबके, तो इंजेक्शन सिर्फ आपके बाल डाई कर रहा है थोड़े टाइम तक और उसके बाद फिर कहानी वहीं का वहीं आ जाएगा. तो सोल्यूशन इंजेक्शंस में नहीं होता. However, other modalities like physiotherapy, acupressure, acupuncture, no harm. प्रॉब्लम ये रहता है, पेशेंट्स का अक्सर फीडबैक ये आता है, सर दर्द रहता था, हम एक्सरसाइज करते थे, फिजियोथेरेपी कराया, रिलीफ मिल गया, बट जब छोड़ा फिर कहानी वहीं हो गया. ट्रीटमेंट, नी रिप्लेसमेंट, वो डिसीजन पेशेंट को अपने आप लेना है जब उसकी क्वालिटी ऑफ लाइफ पे इफेक्ट करे. Not on X-ray, not on MRI, not on opinion of doctor or of the attendants. It is the patient has to take the call. और नी रिप्लेसमेंट में पेशेंट अक्सर सोचता है कि मेरा पूरा घुटना निकाल दिया जाएगा, नया नी डाल दिया जाएगा. ऐसा नहीं होता है. नी रिप्लेसमेंट में सिर्फ और सिर्फ हम पेशेंट का जो कार्टिलेज खराब है उस हिस्से को निकालते हैं, जो नी में टेढ़ापन है उसको सीधा करते हैं और उसमें नई सरफेस डाल देते हैं. जैसे कि अगर हम समझाएं तो जो पहले घुटने के ऊपर जो खराब कार्टिलेज था ये निकाल दिया जाता है, उसको जो टेढ़ापन है सर्जिकल टेक्निक से सीधा किया जाता है टांग को, उसमें शेप ऐसे कट्स दिए जाते हैं ताकि उसके ऊपर जोड़ नया बैठ जाए, और इसी को हम नी रिप्लेसमेंट कहते हैं. उससे पेन में रिलीफ मिल जाता है, क्वालिटी ऑफ लाइफ बहुत अच्छी हो जाती है. इसमें एक क्वेश्चन आता है कि इसकी पहली चीज़ की लाइफ कितनी होती है. 15 से 20 साल आराम से निकल जाते हैं, चाहे कोई सा भी इम्प्लांट डाला जाए. ऑफ लेट हम इंडियन नीज ही यूज़ कर रहे हैं एंड एक्सेलेंट रिजल्ट्स, कोई ऐसे इशू नहीं आ रहे, एंड इट्स मोर देन 10 years नाउ. सेकेंड, एक पूछा जाता है कि इसकी कॉम्प्लिकेशंस क्या होती हैं. सिर्फ एक कॉम्प्लिकेशन होती है, वो ये कि उसमें इन्फेक्शन या पस ना पड़ जाए, जो कि किसी एक आम प्रोसीजर से होता है. इसलिए जहाँ भी मेजर सेंटर्स पे ऑपरेट होते हैं वहाँ पे एक स्पेसिफिक प्रोटोकॉल फॉलो किया जाता है कि इन्फेक्शन रेट ना हो. अदरवाइज बहुत ही सेफ प्रोसीजर है, जिसमें एक दिन सर्जरी के 2 घंटे बाद तो पेशेंट को बैठा के खड़ा करा दिया जाता है एंड अगले दिन से रूटीन चलना फिरना शुरू करा दिया जाता है. और एक घुटना है तो 3 दिन में छुट्टी कर देते हैं, दोनों घुटने तो 5 दिन में छुट्टी कर देते हैं. हालांकि ठीक होने में 3 महीने लगते हैं, बट 3 महीने पेशेंट बिस्तर पे नहीं पड़ा रहता फॉलोइंग नी रिप्लेसमेंट. 3 महीने ऐसा होता है कि मैं चल रहा हूँ, घूम रहा हूँ, बीच बीच में दर्द हो जाती है. या सुबह सो के उठता हूँ तो मेरा घुटना स्टिफ मिलता है, ये टाइम इम्प्लांट और बॉडी को एडजस्ट करने में लगता है, जिसका कोई शॉर्टकट नहीं है। तो मेनली नी पेन में, ओए नीज में नी रिप्लेसमेंट ही होता है। यंगर जनरेशन में, दैट इज 45 एंड बिलो, 25 to 45 में जब नी पेन्स होते हैं, उसके कारण कुछ और होते हैं कि उसमें कहते हैं कि जोड़ के अंदर जो लिगामेंट होता है, जिसको कई लोग झिल्ली बोलते हैं, मेनिस्कस हम बोलते हैं या लिगामेंट बोलते हैं, वो टूट जाते हैं। उसमें फिर की होल सर्जरी से उसको ऑपरेट करके निकाला जाता है। उसमें एमआरआई का ज़रूरत होता है। पेशेंट्स 50 इयर्स एंड अबव अक्सर स्टैंडिंग एपी व्यू से काफ़ी नॉलेज मिल जाता है, एमआरआई का ज़रूरत नहीं पड़ता है। मोर और लेस यही पॉइंट्स थे। हाय, हाय Kriyanshi, any question? Nidhi. Hello Nidhi, any question? Well, Nidhi has asked a question that her mom is facing knee pain and she's just 40 years of age. Well, 40 years is too young an age if the knee pains have started. So, what is her body weight, Nidhi? Is she obese? Okay, so obviously 40 looks like she is a bit obese. First of all, she has to reduce weight to prevent her knees from getting damaged. Secondly, regular walk. Third, must realize what I just showed. 0 to 35, almost your knees would be like this. 35 to 55, there is a cartilage wear. Now, if you are obese, if you are fat, you will be putting more load on the knee and knee will wear out faster. This is the age where many would advise, if pain is not resolving with physiotherapy, to undergo injection therapy. That will provide relief, but that injection will relieve only for 3-4 years. After that, again the problem will cover. So there should be no immediate shortcut treatment. Ideally, you have to go with physiotherapy, exercise, weight reduction, see for 4 to 6 months. If it settles down, avoid an injection. Otherwise, injection can be thought about in that PRP or viscosupplementation. We usually need a standing X-ray, both knees AP standing, if there is pain and no other symptoms like locking or giving way. If the knee causes locking or giving way, then only we consider an MRI. Her question is, so what would be the exact age for operation? Well, age is never a criteria for a knee replacement. The youngest patient we have operated or I have operated is 28 years old, and the oldest which I have operated is 88. It all depends how bad the knee is damaged, what the problem is. In rheumatoids, if it's very early and patient is unable to walk, there is no other option other than knee replacement. But in a degenerative joint disease, it should not be done ideally before 55, 60 years. Any patient in below that, I think they are considered a bit too young. Ideal age would be 60 and higher age is 70 for unilateral or bilateral. And for both the knees, ideally that is the age group. Single knee after the age of 70, one should be done one at a time. That is more safe practice, to be honest. So it all depends. Exact age. Exact age I already answered.
Yes.
Yeah. Any other? Well, I hope you would have learned some few things, very basics though, and we'll see you next time soon, perhaps next month. This was our first activity. Would have learned some few things, very basics though, and we'll see you the idea behind this was to know that when a knee should be replaced, when it should not, that is more important, because if an unindicated knee replacement is done, that patient usually is very unhappy. So perhaps I would have thrown some light into the basics, what is the why knee replacement is done, what is the age, and what are the options available, and hope to see you soon next time. Thank you.
I think you have learned a lot from Dr. Ashish Jain, and if you have any other questions and queries, you can drop your comments. Dr. Jain would reply it shortly. We would be live again after a month, so thank you so much for watching.